is a huge honor for me to be podcast interviewing Dr. Marty Lipsey, DDS, MS. I love your name, it's medical billing from dentists, and you call it a medical billing from A to paid. And his website is medicalbillingfordentist.com. Dr. Marty Lipsey received his DDS degree from UCLA and an MS degree from Northwestern University Dental School. Dr. Lipsey is the founder of Dental Sleep Medical Systems and Medical Billing for Dentists, offering dental teams assistance in implementing and improving their dental sleep medicine practices, including outsourced medical billing and successful insurance coding and processing. Dr. Lipsey lectures nationally on dental sleep medicine and medical billing and is a full-time advocate for sleep health and effective medical billing for the dental team. I would, before anybody sits there and says, well, you know, this is sleep medicine, I don't do sleep medicine. Is what you're going to talk about today all for sleep medicine, or are there other things besides sleep medicine that medical billing does?
There are definitely other things in the dental office that we can do medical billing for. I'm certainly happy to, give you some examples and talk about that as well. Certainly for people who don't do sleep, we have clients who don't do any sleep that we do medical billing for other procedures. So certainly that's a great topic. But I think that one of my goals as I talk to you and other people is to really emphasize one of the last things in the bio, that I'm a big sleep health advocate, and I'm always trying to get more of our colleagues just more sleep health aware and more interested in screening their patients for sleep health, because I think we can help our loved ones, our patients, our friends, and even ourselves be around and alive longer by just becoming more aware of the airway and looking at that and evaluating that, along with the many other wonderful things that all of us do.
Well, when I got out of school in '87, I don't think anybody ever mentioned sleep apnea. I don't think anybody even said the term one time. When did this all come about? Why is it that this is here now? And
well, I think it's just more on every media front now, whether it's on television or online or in print, that it's just so much more public awareness of sleep health. You've even got the mattress guys wherever you're living trying to sell you new mattresses just because, for them, they want to do more business, and that's going to cure people feeling tired every day. We have so many people that are looking for an answer because they're sick and tired of being tired. And this is so much in the public awareness world that I think it's easier for us to talk about it and offer people advice that they may not be able to get elsewhere, certainly sometimes even from their medical doctors. So it gives us a great opportunity.
There are some people our age saying, this is just another fad I've seen in dentistry. I mean, is this the latest, do you think it's another fad, or do you think it's here to stay?
I don't think it's a fad at all. I think it's probably going to be the most long-lasting thing in our practices. That, economic changes have probably affected our dental practices more than they'll ever affect what I call the medical world of our dental practice, including screening and treating sleep breathing disorders. Look, I graduated before you, and we still have the same dental insurance benefits that we did for patients so many years ago. So that's an economic factor that we have to deal with. And for sleep, we've got medical insurance benefits that are just getting better as time goes on. And it's such a comorbidity, such a coexisting problem with every other major disease, pretty much from head to toe, that as our awareness increases, as the medical world and the public's awareness increases, that I just think more people are going to be looking for solutions, including the dental solution that we can offer, and that the coverage for this is far from as widespread as it's going to be in the future.
I went and checked myself in for a night and had all the electrodes and the whole deals, and they said I was an excellent sleeper. I think the reason I thought I had sleep apnea is because my two cats, they're asleep 20 hours a day, and I just feel like I'm not getting enough sleep whenever I look at my cats. They're the two laziest entities on earth. So what's the true scoop about medical billing in the dental office?
Well, medical billing is really all about documentation. a lot of dentists want to do medical billing, and I think we have to realize that to do medical billing, we have to have medical necessity and medical grade documentation. Unfortunately, and I'll generalize here, but I'll speak for our dental colleagues that we don't write very good notes when in comparison to the medical world. And that comes back to bite us if we're trying to get paid by medical insurance for things we do in the dental office that might be medically billable. Because if our documentation isn't there, it's the same as if we didn't do something and then medical billing falls apart and people say it doesn't work. So it's all about the documentation. In the sleep world, we get bailed out, I'd say more than a little bit, because the sleep physician writes the sleep study results up, and that is often the main documentation that we need. So we get a lot of help there from our sleep physician friend. But when we are trying to do medical billing for surgical procedures, cone beam CT, things that are, fairly common or gaining in how often they're done in the dental office, we have to teach ourselves or learn how to make medical grade notes, or we can't be successful with medical billing.
So is this what you're training dentists to do?
Well, I do help dentists. I mean, I'm not really a teacher of making medical grade notes. I do end up with clients that I assist with that all the time. I mean, our bullseye area is sleep. And I would say that 80 to 90% of our clients are at some level of offering sleep apnea appliance therapy in their offices. And again, they don't have to really up the ante on their notes so much in the sleep world because the sleep study comes from a physician. It's already written appropriately, the diagnosis made by them. But we do have clients, and I'm happy to work with people that want to bill surgical procedures, that want to bill CT, but we also have to then understand the difference between dental necessity and medical necessity. They're not one and the same.
Okay, so what are the areas that dentists have the best chance of being successful with medical billing?
Sleep. And I'm not trying to be repetitive. Sleep is at the top of the list for being predictably successful for medical billing. Equal to sleep pretty much is trauma. Trauma is one of the things that is very predictably successful to be medically billed in the dental office. Trauma is probably the only category where from soft tissue and hard tissue areas that are injured through the actual restoration of teeth that will be covered by medical insurance because trauma is considered a medical cause. Then there are, to me, sleep and trauma are in one category, and then surgery and cone beam CT are in a second category, certainly a step down from ease of predictable success with medical billing, but there are protocols definitely that we can put in play to make medical billing successful when it's medically necessary.
The first, my litmus test on if this is fat or not is like, can somebody do this full time? You know what I mean? And I am amazed at how many dentists I've met who now only do sleep. I mean, it has to be huge when you can name a dozen dentists in a dozen different states who now no longer do root canals, fillings, crowns. My question is, where did you start first? Did you start treating sleep or start billing medical? What was the chicken before the egg?
The chicken is the sleep, but to do sleep, you either need to learn, which I think is a very difficult task, or look for help, look for assistance in outsourcing medical billing. Now, it's almost 11 years ago that I started, and sleep was definitely, I just got interested in it when I read about it. And I was in a GP specialty group. The orthodontist was a junior high school buddy of mine, and the article I read talked about a lot of these appliances having a history in orthodontic appliances. Neither of us knew anything about it. I learned and just got fascinated and have continued to learn. But 10, 11 years ago, there was really nobody to help us with medical billing. And, I like to call myself a systems guy. So I just jumped in, full force and figured it out. And over the few years after that, started developing systems where we helped other offices to do that medical billing for them from the systems that we had taught ourselves. Then we developed systems for teaching other people. But I think that doing the sleep can be done without learning anything about medical billing, because now there are teams like we are to help outsource those things in a very dental friendly way. And it's just super simple. That shouldn't be the barrier.
Okay, so on your website, medical billing for dentists, your sweet spot is that I'm getting into sleep medicine now, and I don't want to learn all the medical billing, so I'm going to have you do it for me.
Yes, I mean you can.
And then what do you do? Do you get paid a percent of the billing, or how does this whole thing work?
It's a two-step process. And it's a two-step process whether we do it or you do it for yourself. No matter who does it, it's a two-step process. The first step, and there's some similarities here in the dental office, we have to do a verification of benefits. I think that there are nuances, and the verification of benefits in the medical world is more involved and more timely for us, because as dentists, I say we're outside the club. We're pretty much across the nation, all out of network with the major medical carriers, some exceptions. But because of that, it's more difficult. And, we don't have MD after our names. So when we call up and we want to check benefits, or someone's checking on our behalf, right away they plug in our NPI or tax ID, and they want to transfer us to the dental department. So it's hard right from the get-go, but we can help offices, and they never have to learn one single medical code by doing this all behind the scenes. So first, verification of benefits. We're going to determine unmet medical deductible to the penny. And remember, we're no longer in the dental world of $50 and $100 deductibles, so we can have hundreds or thousands of dollars. We're going to do the pre-auth process, often very much different and often very much more involved than in the dental world. And sometimes pre-auths in the medical world are handled by either outside third-party companies to the medical carrier, or a separate division of the medical carrier. We do the pre-auths. We also do what are called gap exceptions or out-of-network exceptions. It's a paperwork and phone process that we go through on every case to try to get the patient treated so we can minimize their out-of-pocket and maximize what medical insurance pays. So all these are things that take a learning process. My team are all medical billing people, not dental people who take this on as a side effort. And we return to the office that verification of benefits, along with a financial arrangement that's ready to present, tells the office and tells the patient exactly how much they have to pay. So it's easy case presentation from there. So that's step one. Long explanation, but a lot's involved. And that's the step one verification of benefits phase. Now you present the case. Patient says yes, hopefully. For each appointment, we have a one-page checkoff sheet, very dental friendly. The office checks off what they've done, faxes it into us. We put the codes to it. There's no medical codes, no coding for the dental team to learn. We do the coding, billing behind the scenes, the follow-up. The checks go to the dental office, and that completes the process. So there's a verification of benefit cost. It's a flat fee per case, and there's a percentage we're incentivized to get medical insurance to pay. So those are the two fees involved.
So do you, when you're talking about insurance, the problem with this show is that 81% of our listeners are from the United States and 19% are from about 146 countries. When you're talking about insurance, when you're talking about insurance in Canada, there's just one medical insurance. When you're talking about most countries, it's one national insurance. In the United States, you got Medicaid for the poor, you got Medicare over 65. Everybody around the world has heard America talking about Obamacare. And then there's private medical insurance. Is there any difference in what you're doing between Medicaid, Medicare, Obamacare, private health insurance? Can are these distinctions worth thinking about?
Well, first of all, we can say that, we deal with the American system, so we have clients in all 50 states. This is probably something that is country specific. So if someone from Canada is listening or another country, they're going to have their own system, and our insurance system is not going to apply. And in some countries, the patients are more motivated by what's covered because their insurance system is more or less broad-based. But our clients are all in the United States. So, and yes, there is a difference, but we can say that private pay insurance, this is almost universally covered. Certainly some people, just like dental insurance, have better coverage than others. But with private pay insurances, this is universally covered. HMOs, there are more restrictions as there are across the board. HMOs really, when you sign up and you're covered by an HMO, you're covered by what they offer in-house. And while we do get some HMOs to pay for this, generally HMOs don't cover this. Medicare, which, as I think you mentioned, is a senior system. Government says at 65 years of age, happy birthday, you're a Medicare beneficiary, covers very broadly and probably much more leniently, much more inclusively coverage for treating sleep apnea for all seniors age 65 and older, just basically based by age. This is not a welfare or income standard at all. And the Medicaid system, for the most part, there's always exceptions, it's the insurance world, but the Medicaid system for the most part does not pay for oral appliance therapy to treat sleep apnea.
So Medicaid is for the poor, so it has less benefits. The Medicare is for over 65, and they have a very robust plan because they have the highest percentage of a population that votes at the elections. And the poor people never show up to vote, so they never really get anything dealt their way. If you don't vote, you don't get gravy. Has Obamacare, I know it's called the Affordable Health Care Act. You've been doing this for a decade. Did that change anything, really?
The only thing that possibly it changed, and I don't know whether it's Obamacare or just the state of the economy today, but in some areas we have practices where patients walk in with these larger deductibles. And I always say whether they need toe surgery or heart surgery or oral appliance therapy, that deductible is relevant. It has to be met. So if you want to say that that's from Obamacare, perhaps it is, but we have other practices in some communities where people don't have high deductibles and they rarely have to deal with that. But deductibles are a fact of life in the medical world, because some people have deductibles in the thousands of dollars, but no matter what they need healthcare wise, a lot of times, I think most of the time, I know for myself, I don't have the highest deductible, but by choosing a higher deductible saves me thousands or tens of thousands of dollars in premium every year. So I have to now live with paying out of pocket many times, even though I don't like to if I need to seek healthcare services.
You and I are grandpa. Are you a grandpa yet?
I'm a grandpa. I'm a grandpa.
I'm a grandpa too. A lot of the millennials are coming out of dental school, and so we're both grandpas who've been doctors in the U.S. healthcare system. This might be a little off topic, but a lot of millennials come out of school and say, "Wouldn't it be better for universal healthcare that they read from a bunch of other countries?" Do you think podcasters are generally under 30 years of age? Almost every email I get from a podcast listener is under 30. Do you think when they're grandpas like me and you, that the United States will be universal health care? I mean, is that where the trend line's pointing or not really?
Oh, you're asking me to theorize about stuff that I'm probably not the best person to do. I mean, I really, I don't know what to say to that. That's a big, wide open question. And, maybe for the politicians or people that are just, more involved in the different ways that the healthcare system is developed and plans are developed than me. But, from my area of this, looking at treating sleep apnea, I just think as the whole population, is really the whole world, becomes more aware, the treatment for this is going to increase because people are going to demand more broad treatment options in their healthcare policies, because people are sick and tired of being tired. And when they can realize that there's help, and it's not just CPAP, that there are oral appliances that often are a better option and certainly should be an option so patients could make a choice. I think that, if the question's directed in that format, then it's not a concern for me, even as a very young dentist, to should I learn how to treat sleep. I think this has the most long-term potential of being an incredible service to offer and an incredible revenue center for the practice.
Okay, I want you to put on your, so before we start giving instructions on how to drive from Phoenix, my house, so where are you in Cali?
Well, I am in the Los Angeles area.
So
I have my billing office where the phone calls come into is in Modesto, California, so central northern California, but right now I'm in the Los Angeles area.
Okay, so it's from my house to LA is 6.5 hours. And So before we start talking about giving me directions how to go from my house in Phoenix to your house in LA, these kids, I know how they're thinking. They're thinking, okay, first they have regrets. They walked out down school $350,000 in debt, and they say, I didn't do one ortho case. I didn't do one Invisalign case. I didn't place one implant. They didn't cover TV. So they can only learn so much. So I just got out of school. This is August 3rd, back May. 5,000 and walked out of school, and they're like, okay, what's the best return on investment? Should I go learn Invisalign, short-term ortho, surgically place implants, sleep medicine, TMJ? What would you say to her?
Well, I'd say, become as well versed across the board as you can. But I'm biased now, Howard. I'm biased towards this area. So I'm certainly going to tell people, especially young people, that you should learn more about sleep, because there's so many possibilities and really so few dentists doing this. It's a tiny, tiny percentage of the overall dental world that is offering this to their patients. And there are more and more physicians, sleep physicians and other specialists coming into the fold of understanding that they want a dentist on their team. And as we get better with getting medical insurance to pay for this, compared to 10 years ago, it's night and day. There's a world of opportunity for young dentists. And look at the stress scale. I challenge you to find anything else at our offices that's probably as low on the stress scale as making these appliances to treat sleep patients. Now, with that said, I want you to understand that I'm not belittling the science behind this. I think it's critical to have a good understanding of that. But from a clinical basis of appliance therapy, this is way low on the stress scale for what we do.
I know Invisalign, ortho, sleep. I mean, that's low stress, blood free dentistry.
It is.
I mean, not to be rude, but I mean, you have to be pretty on your toes when you're placing implants. You got flaps. You're avoiding sinuses. You're looking at CBCT. Blah. I mean, that's high stress world. Endo. I mean, if you don't watch what you're doing, endo, it can be a perf. I mean, things can go bad quick. But Invisalign and sleep is a lot lower stress. Would you agree with that?
100%.
Well, let's say you had carpal tunnel syndrome and you couldn't do endo. Could you do Invisalign and sleep?
Sure. And again, state by state, it's different depending on dental practice acts. But, impressions can often be taken by auxiliaries, depending on what type of instrumentation or equipment you decide to use in the sleep world. There are acoustics that we often use to assess collapse of airway and the best position to take the bite. That's often done by staff that become much more expert in that than the dentist. And a big part of this is staff driven. It is much more along the ortho model than the general dentistry model. And it used to be 5 to 10 years ago, when I lectured, the typical guy in the audience, sorry, not picking on you, Howard, was a balding white guy, an older guy, much older than you. But now we're getting more younger people all the time.
You lectured mostly to modeling agencies?
Yeah, that's it. But times have changed. And there's a lot more younger faces, younger people in there in the lecture groups, and they're recognizing that this is something that they should learn more about. And it's interesting. We all sleep, and no matter what wonderful things each of us does in the dental office, all your patients, all your family members don't need everything that you do, but everybody sleeps. And everybody appreciates a conversation about sleep health. It's something that we all have in common. And I guarantee you, just through those conversations, sometimes too much information, but we get a lot of information that we can do wonderful things in terms of helping people. And there's nothing else in our practice, in my opinion. And, if anyone wants to disagree with me, that's fine as well. I don't think there's any service we can offer that's as life-saving and life-lengthening as treating obstructive sleep apnea when it's appropriate to be appropriately treated with an oral appliance as one of the treatment options.
I know. So what's the best training? She's listening to you. She's saying, come on, Marty, I didn't get 1 hour lecture on sleep. Where would you recommend I go? I mean, and also I got to tell you the bias on Dental Town. the number one complaint from your industry is that they go to these lectures to learn sleep medicine when it's really about trying to sell you a piece of equipment. They sell you the piece of equipment, and that's the end of your relationship. Where do you recommend going for learning this?
Yeah, and I understand that complaint and that concern. And, I think the reality is often these 1 and 2 full day lecture programs are sponsored by companies that do sell equipment. I mean, they're in business to sell equipment, and they put on these seminars, but that doesn't lessen the fact that there are many good 1 and 2 day programs out there that are very instructional and very implementation friendly in terms of implementing a sleep screening and treatment protocol in your dental office. So I don't think, that these companies twist people by the arm to buy equipment. And I, know that I teach and we demonstrate equipment and for the company that I teach for, but it's a great protocol. It's a great implementation ready and friendly protocol in the dental office. And if people want to choose equipment A or equipment B, that's up to them, but that shouldn't limit you from looking at these different programs so you can educate yourself and compare one to the other and say, this bite technique makes sense. This one looks like it's a total guess to me. This guy had a great way of explaining it, and the other one maybe quoted more research, and I'm not a research guy, and for my practice that didn't help me to implement. The first seminar I went to was great. The speaker was great. I learned a ton. And this is a new world of language. It's a new vocabulary. There's a lot of alphabet soup here. It did not send me home being able to feel that I could start this in the practice. I went to a different seminar. I heard a lot of the basics again, but the implementation ready presentation, it took me a second try, was bullseye, bingo, and that's how we got started, made it successful, and went on from there. Unfortunately, there's not a lot of dental schools, especially to undergrad dental students, offering programs. But post-grad, Tufts has a program, UCLA has a program, maybe others that I'm not even aware of. And many of the dental schools themselves put on half-day, day courses in sleep now. It's getting more of an offering because there's more of an interest. So on the flip side of the coin, I just caution people, on whether it's billing or clinical courses, there are unfortunately too many overnight experts, and I think that comes out of that this is a hot button. So look for people and courses and systems that have been around for a while, and then they probably survive the test of time.
So back to insurance verification. When we got out of school, that was all done by you hired a human to sit up front, and every patient that comes in, you got to call, is Marty Lipsey really covered? What's all this stuff? Has that been automated, or is that still best done by human to human?
It's still best done human to human, and it's very time consuming. And that's one of the biggest problems a dental team would have, is finding someone that has the time to do this. Because if you take the time away from people that are expert at doing other things, and obviously this is new to them, so it's going to take them longer to do this, that's not efficient, that's not productive. And so I'd really say to people in the beginning, unless your brother's a sleep doctor and right from step one he's going to send you 10 patients a day, outsource this. It's going to cost you more money to try to learn how to do it. These cases revenue-wise are in the thousands of dollars each. You cost yourself one case because of mistakes, omissions. I always say small omissions, small errors make big mistakes here. And clinically, you can learn there are many good protocols for this. But if in the case presentation and insurance protocol, you make one mistake in a case that's thousands of dollars that easily could have been avoided by reaching out to get help, not reinventing the wheel, I just think that it's not a way to go.
So back to the learning sleep medicine. I already know the complaints I'm going to get from this podcast. You're not mentioning names. You're talking generally. Who she wants to know, where do you go? Name a company, a website. I want to learn sleep. You're talking about 2-day courses. Name names, name websites. Who do you recommend?
Well, I'll name a couple names for you. Whether and I'm not involved in all of these, but I'll give you a couple of examples. I do teach for Sleep Group Solutions, And you can
Is
Google
that
sleepgroupsolutions.com.
www.sleepgroupsolutions? Just like it sounds.
Yeah, they give probably 100 seminars, 100 two-day seminars a year.
So you recommend sleepgroupsolutions.com.
There are about 8 or 9 of us as dentists who teach those courses. And while we all use the same slides and we have different backgrounds, I think that puts a different twist on it. Obviously, we all have our own personalities and areas of emphasis, but we cover an implementation-friendly and implementation-ready protocol. That's a great way to learn. And you can make a decision for yourself looking at equipment and sleep testing devices there, whether you want to implement that protocol or not. But I guarantee you this, you'll come away from that 2-day program with a heck of an education and an ABC recipe where you could put this in play from Monday morning. So that's one. I'm not as familiar with all the others, but there certainly are regional courses that you can start with. I just spoke at the National Dental Association meeting in Atlanta. I'm speaking at the Sacramento District Dental Society meeting next February, and there are many other speakers around the country at different dental meetings, whether it's a 2-hour or half day or longer program. Those are all ways to at least get a beginning understanding of the science and pathophysiology and the terminology, because with rare exception, we have not learned this in dental school. Henry Schein puts on some classes as well. They have a program called Sleep Complete. And I think their main lecturer is Dr. John Tucker, who I've never met, but I've only heard great things about his lectures. So that's another place that people might look. And, some of the companies that make software for...
His name was John Tucker?
John Tucker.
Okay.
And I think that he's the main lecturer for the Henry Schein program. Again, I have no personal involvement in that, so I'm not as aware about the details of that. I'm trying to think of anyone else that I know that gives a regularly scheduled series of lectures. Dr. Mark Abramson. Dr. Mark Abramson, he's out of the Northern California area. He lectures around the country, I would say, at least 4 to 6 times a year in different venues. For those of you that are golfers, I know he always does something in conjunction with the Pebble Beach tournament. So, and Mark's been involved in the sleep world for many, many, many years. He's an appliance developer, inventor, whatever you want to call it as well. He's also one of these meditation evolution guys that talks about how airway problems evolved in humans. It's pretty interesting. So that's another lecture that's repeated, and you can get information from that online, I'm sure. I'm drawing beyond that. I see things that come through from time to time on courses around the country, but those are the ones that come to my mind as far as regularly repeating lecture series that you can pretty much plug into for a date and place that's convenient to you.
Okay, talk about the economics of this. She's listening to you right now. She says, okay, we did 750 last year. We got 1,800 active patients. We don't do any sleep. What can a practice like mine? I'm doing 750. I'm taking home 150. I'm not doing any sleep. If I go down the sleep road, how many patients do you think I could find in my practice a month, a year? What is the average revenue of a case? I mean, if they're looking at Invisalign, they get it. They know an ortho case is $6,000, $5,000 for brackets, $6,000 for Invisalign. Talk economics of what happens when an average practice that you've seen goes into sleep over the last decade.
Okay, a new practice starting out, screening their patients, and that's where this comes from. This comes from implementing an across-the-board screening program. And I say there has to be a sort of 2-pronged screening program because we have 2 general paths in most of our practices. We have a new patient path and a recare patient path. So we have to have the team on board, the team educated, and everybody involved in a sleep health screening process. we're going to find on first level of screening that 20 to 30% of our patients have some risk factor, which initially they'd screen positive for possibly having some kind of sleep breathing disorder. So
20 to 30%.
20 to 30%. So that's a huge number.
I mean, that's about as much as perio, right? I mean, what did you say about?
Yeah, I mean, I don't know the perio numbers, but it's just talking about numbers in an average practice, that's a lot of people. Now, I stress over and over again when I lecture, when I talk to offices to, even though it has nothing to do with billing, I stress to them, this is all about screening, education, and presentation. This has to be presented differently than crowns and fillings. This has to be understood. We educate ourselves so we can educate our patients. We can't assume everybody gets it. Even people that have been through the sleep testing screening process on the medical side, they don't always understand how seriously this is affecting and killing them slowly but surely from head to toe. So we have to become experts. One, in the screening process, it has to be universal, not just when somebody yawns in our chair. We have to be able to talk as a team about sleep health to help educate our patients after we've educated ourselves. And then out of that 20 to 30%, we have to have a mechanism, whether it's through referrals to an outside sleep testing facility or giving people an easy path to home sleep testing. Many dental offices either have home sleep testing devices or can direct patients somewhere where they, either by hand delivery or through the mail, can get a home sleep testing device that they can put on and wear in their own bed tonight and get tested. Those results, that data that's recorded, always should be read by a board certified sleep physician. And then we continue the conversation using the results of that test, whether it's an in-lab test or the results of a home sleep study, to review with the patient and spend the time to educate them so that they get not only what the problem is and what the implications are, short and long term, but also every one of those studies is going to have recommendations for treatment from that sleep specialist. And now the recommendations for treatment don't just come from us as the dentist, but they come from the highest level specialists in this area. I think that carries more credence and more worthwhile assessment that we can pass on to the patient.
Okay, so if she wants to get into sleep, you said she can go to sleepgroupsolutions.com, or can she find information on that on your website, medicalbillingfordentists.com? He
or she can certainly find information at both of those websites, medicalbillingfordentists.com and Sleep Group Solutions or sleepgs.com, on getting more education. And on both those websites, there's certainly phone numbers and emails, and I'm always available personally. I talk to anyone that's interested personally. I do the training for every new office we work with.
You take their phone calls?
I do.
What's your phone number?
My phone number is, here's my cell number, 209-380-5486. And I'd welcome anyone as a dentist or office manager or business manager who's interested in implementing or bettering this area of your practice to call me. There isn't a single office that I've ever worked with that I haven't personally talked to them and done their training, because I'm passionate about this and I want to make sure that I've played a personal role in helping to direct them as center bullseye as possible. So I welcome those calls.
So it's 209-380-5486. And do you prefer phone calls or emails?
I'll give you the email as well. They can email us at info at medicalbillingfordentists.com. That's pretty easy. And that goes to all of us. So I will definitely get a copy. And whether it's by email or phone, if you don't hear back from me in a day, please hit me again, because that's not like me. And I'd love to talk to you. I think it's great. And I'd love to help you help your family, friends, and patients to become, look, even if you have no interest in implementing this treatment-wise in your practice, I firmly believe as a dentist staring at the opening to the nasal airway and the entrance to the oropharyngeal airway constantly every day, that minimally you should be a sleep health traffic cop to have a basic level of education understanding so you can pass that on to people you come in touch with to help direct people to the proper path, which isn't always about making oral appliances. It's about people seeing, seeking, and getting the treatment they need for the choking and suffocating that all too many people are doing during sleep and have no idea how serious it is.
And you think a 2-day course is adequate training to get into this, or how much CE time is it going to take before you feel real comfortable doing this in your practice?
I think a 2-day course is definitely enough to get started. I think after a 2-day course that you'll know more than most physicians know. Now, granted, that's not including sleep specialists, but a 2-day course, you will learn a lot. I think you certainly can invite conversations, help educate and screen your patients with that. I think you certainly can begin treating patients with that, but I think it's incumbent upon us, like anything else, to continue to increase that knowledge. And, there is an annual meeting of the American Academy of Dental Sleep Medicine, which is the brother, sister, niece, nephew of the American Academy of Sleep Medicine. That's in late May, early June of every year. A scientific presentation, that's probably at the top of the bunch. The American Academy of Dental Sleep Medicine, and you can look at that website too, aadsm.org. Or just Google American Academy of Dental Sleep Medicine. They put on, for both beginners and people that are already doing this, an advanced course, and they're now starting to add more courses. I sound like an advertising for the AADSM, and I'm not. I am a member, but I'm not politically involved. So if anyone's listening from that group and I'm misspeaking anything, just look at their website and it'll speak for itself. But there's definitely courses there as well that you can.
And what's that website?
www.aadsm.org or aadsm.org. American Academy of Dental Sleep Medicine. That is the like I said, the most closely related organization to the sleep, the medical specialty boarding group, the American Academy of Sleep Medicine. There are 2 other organizations, just so I don't short anybody. There is the Academy, the American Sleep and Breathing Academy, and Dave, if I'm off on the words to match your letters, but that's the ASBA. But you can you can Google that. ASBA, I think it's American Sleep and Breathing Academy or Sleep and Breathing Association, and they're local to you, Howard. They're out of Phoenix.
Really? And which one's out of Phoenix? Which one?
I should be better versed, but I'm not a member of all these organizations. So the American Sleep and Breathing Academy, I'll give a plug to.
Tell me his name. American Sleep and Breathing Academy.
Yes, and the ACSDD, the Academy of Clinical Sleep Disorder Discipline. That's a mouthful. That's also local to you. ACSDD, Academy of Clinical Sleep Disorder Disciplines. And you can look that up online. I know that they do give courses. Those are 2 other academies or organizations that give courses and have events related to sleep. You've got a great local lab in Phoenix, Gergen's Ortho Lab, that has an incredible oral appliance division. And the ASBA is Dave Gergen's associated organization. And they certainly are really well versed and can give anyone seeking more help direction in this area, both from a lab standpoint and probably from a continuing education standpoint as well. So, again, I'm not an expert on every group, every academy, every organization, but for somebody looking to learn, there's definitely different avenues out there. Obviously, I'd love for you to come and hear me speak. If you want to, we'll go back to the beginning. And if you look at Sleep Group Solutions, I'm lecturing in San Antonio in a few weeks. But there's a lot of ways, and I really truly believe that most of us, just because of our dental minds, will find this fascinating. And as I said, we all sleep. And we all have a snorer in the family. I can't believe that there's anyone listening to this that doesn't have someone who snores in the family. And that snoring is often the alarm that there's a bigger fire burning below. And the more we learn about that, I mean, I just think it's totally interesting and something that we can help with, even if we choose not to be involved in actually making these appliances to treat it.
And what I was thrown off by the most is ever since I started going to these courses several years ago, like you'll be at a friend's house and you'll either see, the grandpa, the dad, or even a 5-year-old kid laying there on the couch, basically like, you can just, you're just sitting there, everybody in the room. Do you guys notice this? And they're like, oh, he's always like that. And I'm like, dude, and you're explaining it why some guy's snoring off the top of his deal, and little Jaden. And we were at a house the other day, and this little 5-year-old kid, and it's like you're pointing out to the whole family, like, look at him massively grinding his teeth while he's just taking a nap on his couch. And it's amazing how What do you think of Arietta Huffington's new book? That seems to be the biggest conversation starter in my office. Have you seen that book?
I haven't seen that book, but she's a big sleep health advocate. And
she's a rock star.
Yeah, she's a big sleep health advocate. And I'm sure I'm mistelling this story a bit, but here's my understanding of her story and why she's such a sleep health advocate, that she fell asleep at her desk. I don't know if it was at her computer or her desk. And she actually, I think, broke her cheekbone when she fell. She hurt herself, that's for sure. And I think it woke her up that she was just sleep deprived, a workaholic, and that she needed to get better sleep. Because it's not always about the quantity of sleep. If we're choking and suffocating, and instead of getting good quality of sleep, then that's the same as not getting sleep. So the Huffington Post is a big advocate of sleep health. And again, it's just one of so many ways that this is in the public eye all the time. You talked about kids just now. Kids are not immune. And to see kids gasping for air in their car seats or in the couch, that's scary. But it's also something that while we don't treat kids with these same appliances that we use for adults, we could definitely be good traffic cops and being more aware and making local connections to direct mom and dad to ENT docs, pediatric ENT docs and the like, for doctors that are skilled and understand airway problems in kids and can direct them. In kids, it's often tonsils and adenoids that are causing this problem, but it affects growth. A lot of the times these kids are smaller than they should be because growth hormones not secreted as it should because they're choking instead of sleeping. They're slower in school. They're tired all the time. It's another discussion beyond today, but there are experts out there, more expert than me, who will get up, physicians, and talk to you that ADD, ADHD is nothing more than sleep deprivation, and that we really need to be sleep testing kids more instead of giving them all these uppers and amphetamine type medications. So, that's certainly another topic, but that we can help from small children through adults of every age to live better and longer lives. I mean, that's what it's really all about. That's why this is exciting. And if we can help people do that in a more affordable way that makes it easier for them to say yes to treatment, I mean, that's my personal bias and emphasis in this process. I'm a big sleep advocate, sleep health advocate, as I said in the beginning. I want to get more dentists, more people educated so we can screen our patients, educate ourselves and our patients, and direct people in the right direction. Just one more thought on kids. It is not normal for any snoring or to have any sleep apnea in kids. On adults, there is a level below a certain number on the scale that is the universal scale for choking and suffocating, the apnea-hypopnea index. And below 5, below that number, you're not diagnosed as having apnea. But as a child, there is no such thing as normal snoring. There is no such thing as a normal range of sleep apnea. Mom and dad don't always know that. And Johnny's just choking away when he's sleeping or napping. That is not normal. And I think that parents appreciate our help in understanding that and helping them get to a healthcare professional that is sleep educated so that they could check that out, because you can't always catch up. Years of both physical and mental problems with growth because of choking and suffocating, during childhood periods where growth and development is critical, don't always catch up. So that's another wonderful service that we can help by learning more here.
Hey, I want to say one thing out there first, if there is that 1 out of 100 old guy listening, is that I think in the 70s and 80s, people just, you were either a boy or a girl, or you're either Hispanic or Asian or Caucasian or whatever. And demographics, I think the most important demographics is, how do you think as a baby boomer versus a Generation Next versus a millennial? And I see so many older guys looking at stuff like this and thinking, that's holistic, that's alternative medicine, that's I'm not interested in any of that. And then I see these younger dentists who they'll advertise on their website how they recycle, or how they're off the grid, or that their office is powered by solar, or that they do anything alternative, anything holistic, which is just a huge bad name for every male dentist over 50. They're all the same conservative block of crazies. And my God, when I met Dennis, who started advertising on his website that he was off the grid, his dental office was solar powered and off the grid. He was having patients drive from an hour away just to go there. And I think that you're exactly right. The millennials don't want to treat their ADD kid with Ritalin if they could do it by sleep. They don't want to treat, and that's the other controversy I see with older dentists. They don't like anything to do with alternative medicine. But then you say, well, if you had a problem, would you want to treat high cholesterol with diet and exercise, or take a pill? They go, diet and exercise. If you had high blood pressure, would you want to treat it holistically, exercise, diet, or take a pill? So the older dentists, every question you ask them, they say alternative healthcare. So they really don't believe in the pharmaceutical industry medical model. But then when you say holistic or alternative, they cringe and they don't like it. But their behavior is that they're alternative and holistic, but they don't. But those are two cuss words in dentistry.
Yeah, and I don't know that this is so much alternative and holistic. I think this is really, it is mainstream, but it's not mainstream for us with the dental education, because we didn't get taught this in the mainstream. I think if we broaden out our education, then we can pass that on, and then it can become more mainstream. But I think this whole idea of sleep health is becoming more mainstream than it was even a few years ago, because you can't turn on Dr. Oz or the doctors or the evening news or late night TV anymore. We joke around and say the late night TV and online is when they have, all these boil and bite snoring appliance commercials on, because that's when people are watching that can't sleep. But this is becoming more mainstream, and these are not. That's part of the problem. I think even in the primary care physician world, that sleep is not mainstream. They've got a constant parade all day of drug reps coming in and waiting for them to talk to them when they're in between patients. And, look, there's medications out there that do wonderful things. I'm not on this anti-big pharma campaign at all. But when we can just learn more about what sleep health is and what it isn't for children and adults, and we can communicate that more, the more you learn about this, it's unbelievable, whether it's at family gatherings or you're on an airplane or you just meet people. If I have a sleep magazine or a book I'm reading and someone just catches a little peek at that, boom, the whole conversation's about sleep, because it's just there. It's not, it wouldn't be the same with many other healthcare topics, but sleep is at the top of the heap for public interest. Unfortunately, it's not at the top of the heap for primary care docs and many of the physicians that we see on a regular basis evaluating as part of the mix for heart problems, diabetes, acid reflux disease, so many things. I could go on and on and on. I was just reading glaucoma, 10 times more prevalent in people with sleep apnea. The more you learn about this, the worse you know that it affects us in so many ways that we're only beginning to understand. So if we can understand a little bit more in our own way, I think everybody benefits.
Okay, so I know my homies. I know them well. I've been one for 30 years. I've lectured 1,500 times in every continent but Antarctica. They're listening to this on the podcast. They're driving to work right now, and they're saying, "Okay, I want to learn sleep medicine. I want to learn it, hell, just for myself, my kids, my family, whatever. How the hell am I going to get Charlene up front to start getting in, figuring out all the medical billing? How am I going to get my team involved? I mean, the dentist wants to go learn sleep for all the doctor clinical stuff. But now he's sitting here. How does he get his staff on board?
The staff will all perk up and be interested in this from their own family, their own parents, themselves and their children. I think this is such, I hate to use the word sell, but this is such an easy sell to the team because you're not coming back from a seminar or wanting to learn something where they may not be affected. I think it comes back to they all have snoring people in their families. They all know someone in their family whose spouse has to sometimes or all the time sleep on the couch. So a lot of times our first patients become hygienist's husband or the spouse of someone who works in the office because they want to get back in the bedroom, because they want to stop falling asleep watching TV every night, because some of them want to stop falling asleep when they're driving. This is a dangerous problem, but I think that staff motivation is not at all a problem. Take as many staff as possible with you when you go to these lectures. Let them be exposed to it. They will see this is not something that maybe next year we'll see someone or I'll see someone in my family who's affected. You sit through a few hours of the first day of our seminar and you're already probably counting how many friends and family you have that need probably some kind of help and direction. And I will tell you, as being involved in this, as you know, I'm going back to something I already commented on before, but when my friends learn that I'm lecturing about this and I'm out to dinner with them, it comes up. They want more help. They want more. They want to learn more. There's so many people that have been directed to wear CPAP, to wear that mask from the medical side who aren't, who can't, who don't want to, that need to be aware, that aren't aware that we have a great treatment option, that we can help them. And the same for children, that we can help, push Johnny and Susie in a direction to get the care that they need on the medical side when they're choking and suffocating and taking their naps or at night, because that's just not conducive to normal growth and development. So I don't think the staff is a problem at all, but please, for those of you listening, don't come alone. Come to the lectures with at least a couple of key staff people. You find so often that the dentist comes alone only to come back a second time, and now the whole crew is there. I'm going to talk about sleep group solutions protocol again, because if you do become a client after a lecture, they come to your office for a full day of training. Who's the most interested in that training? Well, as interested as any of the doctors is the staff, because they want to be not just hands-on with the appliance therapy, but more educated for family, friends, and people they come into contact with. So I just think everybody's going to be excited about this. It's easier than almost anything else you ever added on to your routine because of that. And give it a try. You'll see that I'm right.
Well, me and Marty have done this for more decades than you've been alive, who's listening to this right now. And the bottom line, he just said two profound things that you got to get. In me watching people come out of dental school, going to the top or having miserable careers or failing, couple things stand out. Whenever you go to a lecture, half the room is all the dentists coming by themselves to save money. The other half of the room, every row is a complete office. It's the doctor, the spouse, the hygienist, the receptionist, assistant. If I went out there and collected the tax returns, the dentists who always take all their staff to all these seminars, they always take home twice as much money as all the dentists who come alone saving money. I would rather you send the whole staff and the doctor go home. That would be a better formula than you going without your staff. So just always, and then a lot of people say, well, what if I spend all this money educating my team members, then they leave? And I always say, well, what if you don't educate your team members and they stay? That would be the biggest nightmare. So the bottom line is, it's always staff. And the other thing is this podcast, and I'll tell you why I do this podcast. I noticed that the dentists who came out of school that took minimum 100, 200, 300 hours of CE a year, after 10, 20 years, they were completely on the top. And I wanted to make online CE faster, easier, better, cheaper. So now I get the most amazing guests like Marty on your iPhone for free. If that ain't faster, easier, better, cheaper, I don't know what is. Marty, I want to finish with, I only got you for 28 more seconds, so you got to go in overtime, but tell them exactly what they find at medicalbillingfordentists.com on their iPhone. What exactly can they find and do? What's the next move?
Hey, you've got a connection to us. So check us out on the website. We've got some good videos on there, some testimonials. It tells more, I think, about what we do. It gives you your connection to us. info@medicalbillingfordentists.com. Email us. Call me. I'm always available personally, and I'd love to help you get more information about how you can start or improve this area of your practice, your life, for your family, friends, loved ones, and patients. And it's just a great area that I'd invite you to come and take a look at.
And if you're in the bathroom at Circle K right now, right on the wall, his phone number, 209-380-5486, right, for a great time. If you really want to have fun sleeping, call this number, 209-380-5486. What do you want him to write on the wall, Marty?
I don't want him to write that on the wall, but right on the wall, call me, and or don't write it on the wall, but
just
you
write on the
me
wall for the best sleepover ever. Call 209-380-5486. And remember, folks, no one pays to be on this show. This isn't an infomercial. I called Marty. He didn't call me. Marty, thanks for all that you do for dentistry, and thanks for medicalbillingfordentists.com. And you're right about the sleep medicine. I think that what motivated me the most in those courses, and the reason I got involved, is I have 4 boys, and I was already thinking, I don't want to say his name, I don't want to get back to one of them. I just said, oh my God, he has it. I knew I had it, and I ended up not having it. One of my boys I thought probably had it, and then it's every dinner conversation, because you start talking, and I'll tell you what would please a woman coming into your office more for a 6-month recall, that you remove all the tartar and stain off her teeth, or you start a conversation about her husband snoring, which has been driving her insane for the last decade, and she gets up and goes out on the couch 2 or 3 nights a week. This is huge. It's fun. It's alternative. It's holistic. It should be on your website. And Marty, thank you so much for all that you do for dentistry, and thank you so much for spending an hour with me today.
Hey, thanks, Howard. I enjoyed being here. It was fun, and I didn't know what to expect, but I hope we got some people interested to learn some more about sleep, to look us up, and to move forward in this area of educating themselves, their family, friends, and patients. Thanks again.
All right, buddy. Thanks for all you do.